Dementia is a growing epidemic in the United States. There's a very good chance that you personally know someone who has had dementia. The various forms of dementia are vascular dementia, mixed dementia, dementia with Lewy bodies, frontotemporal dementia, and Alzheimer's disease. Alzheimer's is the most prevalent form, which covers about 50 to 80% of the total dementia cases. It's characterized by a complex of neuropathological, biochemical, and behavioral symptoms that will gradually impair your memory and ability to learn, while it also affects your ability to carry out activities of daily living. The prevalence of Alzheimer's disease doubles approximately every 20 years, with the current number at about 5.4 million Americans. Without major breakthroughs in prevention or treatment, that number could climb to 16 million by 2050. The economic cost is also very large on society, as aggregate payments for health care, long-term care, and hospice for Americans with Alzheimer's disease are currently $200 billion and projected to increase to $1.1 trillion by 2050. It is also the sixth leading cause of death among individuals over 65 years of age. The characteristics of dementia and Alzheimer's disease include memory loss, personality change, trouble with performing activities of daily living, weakness, and poor balance. Alzheimer's and dementia are progressive diseases. In the beginning, memory loss is mild, but with late-stage Alzheimer's or dementia, patients will lose the ability to carry on a conversation and respond to their environment. It can't be diagnosed, which can be a large issue for many medical professionals. The only diagnosis can come after death, by the viewing of plaques and tangles on the brain. However, medical professionals do run a battery of tests which include blood tests, physical examinations, mental tests, and are usually around 90% accurate in their diagnosis. I found it interesting that there had been reported risk factors that you could control for dementia. Among these include alcohol use, atherosclerosis, blood pressure, cholesterol, depression, diabetes, high estrogen levels, homocysteine blood levels, and smoking. It was interesting that exercise can affect most of these risk factors, which goes to show exercise can be used as a preventative treatment for diseases such as dementia and Alzheimer's.
A traumatic brain injury occurs when an outside force impacts the brain. Traumatic brain injuries are a serious public health problem in the United States. On average, 1.5 million Americans sustain a traumatic brain injury. Of the 1.5 million Americans, 50,000 have an injury serious enough to result in death. It is common for individuals to adopt a sedentary lifestyle after this injury. This increases the risk of developing further health complications. If exercise is incorporated into their recovery, many positive health benefits may occur. Common causes of traumatic brain injuries are car accidents as well as sports injuries. Traumatic brain injuries are commonly separated into different severities based upon the degree of which the brain has been injured. The different severities can be expressed as mild, moderate, and severe. Mild traumatic brain injuries generally result in a brief loss of consciousness ranging from a few seconds to a few minutes. A complete loss of consciousness does not always need to occur. A person may just experience dizziness or confusion. A scan will show normal brain imaging results. Approximately 75 to 85% of all brain injuries fall into the category of mild. A moderate traumatic brain injury results in a loss of consciousness ranging from 1 to 24 hours. Confusion will last for days to weeks. Some cases show cognitive and physical impairments lasting for months. A severe traumatic brain injury occurs when there is a loss of consciousness or coma for more than 24 hours. Both the moderate and severe traumatic brain injuries will show abnormal brain imaging results. Depending on the severity of the injury, a variety of symptoms may be seen. Common symptoms include headaches, fatigue, dizziness, trouble concentrating, blurred vision, bothered by light or noise, temper, irritability, anxiety, memory problems, as well as troubled sleep.
Being exercise scientists, we know exercise's effect on the brain and body. Physiological benefits include improved cardiovascular efficiency, decreased body fat percentage, increased metabolism. Psychological benefits include positive mood, reduced stress, improved sleep, and increased neuromuscular control. It was interesting to see in a study by Gatz that cardiorespiratory fitness is one of the strongest predictors of morbidity and mortality, going to show once again that exercise is a good preventative treatment for any type of disease, including neurodegenerative diseases.
Before exercise can be performed after suffering a traumatic brain injury, an adequate amount of rest must be achieved. The amount of rest time required before exercise depends on the nature and severity of the injury that has occurred. It can be very damaging to the brain if exercise is performed too early in the recovery process. Premature exercise appears to suppress neuroplasticity response to the brain injury. This extends the amount of time it takes for the brain to recover. Some individuals, such as athletes, may have a hard time accepting this extended rest period. They are used to a high level of daily activity, so oftentimes they skip the rest period and get right back into their training. This can have many negative consequences to the brain. Exercise has been proven to be an effective method used during the recovery period after suffering a traumatic brain injury. Post-injury exercise can improve performance in spatial learning and memory tasks when compared to those who are sedentary. Muscle loss may have occurred during their extended period of bed rest. Exercise can help to build back that muscle that they have lost. Emotional distress and depression commonly occur after a traumatic brain injury. Exercise can be just as effective as medication for reducing the effects of depression. When mild traumatic brain injury symptoms last for more than 6 weeks, exercise can be very beneficial for reducing the symptom burden. Different exercise intensities will have different effects on the body and need to be considered for each patient. Many athletes participating in contact sports suffer from concussions. A concussion falls into the category of mild traumatic brain injury. After many years of intense training, many athletes do not want to let their body rest after a concussion. They want to get right back into their training. If the proper amount of rest is not achieved before exercise, the brain is much more likely to obtain a second concussion. When a second concussion occurs, the brain can be considerably more susceptible to damage because of ongoing pathology from the first injury. Because of the abundance of cases in which athletes return to their sport too early and experience further harm, many protocols have been developed. Athletes must pass several tests by doctors before they can be cleared to return to participating in their sport. These procedures and protocols have reduced the amount of recurring concussions and helped to save many lives. There are a variety of exercise methods that can be used by traumatic brain injury patients. Depending on the state of the patient, various exercise methods can be incorporated into their recovery process. Generally speaking, the less severe that the brain injury is, the more physical the patient can be. Patients with severe traumatic brain injuries will be much more limited as far as what exercises they can do. Most physical therapy programs focus on specific impairments such as flexibility, muscle force production, balance, and functional skills. Once they build up these basic skills, they may be able to start performing more advanced specialized exercise routines. Aerobic training, if performed correctly, can have many positive effects on the recovery of traumatic brain injury patients. Because of the extended period of inactivity, that takes place after a traumatic brain injury, aerobic capacity is generally reduced significantly in people recovering from a traumatic brain injury. This will lead to a much earlier onset of fatigue while exercising. Over time, fatigue from exercise will improve, and the patient will be able to exercise for a longer duration. Aerobic exercise can have a positive effect on how long it takes the brain to recover from its injury. 30 minutes of aerobic exercise done 3 times a week can reduce the symptoms of depression and help to boost self-esteem. Circuit training is a method of exercise that combines resistance exercise with aerobic exercise. This type of exercise can be very beneficial due to the variety of exercises that are performed. Many traumatic brain injury patients have a hard time staying motivated to exercise when they perform the same tasks over and over. Circuit training enables sessions to vary each time, which makes them more interesting to patients that easily get bored with repeating training. Circuit training allows traumatic brain injury patients to improve aerobic capacity while strengthening major muscle groups. Circuit training has been shown to be very effective during the rehabilitation process of traumatic brain injury patients.
According to several studies conducted in 2013, exercise in aged rats improves learning and neurogenesis in the brain. It also prevents gray matter atrophy in the cortex of the brain. This is a huge findings because gray matter atrophy is one of the main aspects of dementia and Alzheimer's disease. So if exercise beforehand can help decrease the atrophy of gray matter in the cortex, that will help ward off diseases such as dementia and Alzheimer's. In a study conducted by Hassini in 2013, they used rats and injected them with NBM lesions on the brain, which are similar to the lesions found in Alzheimer's disease. They had the injected group and also a control group of rats that didn't get any injections. Both the control group and injected group were both split into treadmill and non-treadmill group who had exercise every day or no exercise at all. The results at the end of the trial were that the treadmill groups of both the injected and non-injected rats had improved learning and memory from the pre-test. This goes to show that in both diseased and non-diseased brains, exercise can increase plasticity and create neural pathways, which encourages learning and memory. I was only able to find one cohort study done on Alzheimer's disease and dementia. The study I found was very large. It had 19,548 subjects, including both men and women. All of the subjects had a midlife examination done, which included a medical history, physical examinations, blood tests, and a cardiorespiratory fitness level treadmill measurement. Individuals with previous cerebrovascular disease were excluded from the study because the effect on the brain that their disease may have had was unknown. The mean follow-up time after the midlife examination was 24 years. The results of the study showed that the higher midlife fitness levels seemed to be associated with lower hazards of developing all-cause dementia later in life. The hazard ratios were 0.64 compared to 0.74 for the low fitness individuals.
A study was performed by Hoffman in 2010 to investigate if a structured aerobic exercise regimen would decrease the severity of depression symptoms in people with traumatic brain injuries. Anxiety, insomnia, and pain levels were also considered during this study. There were 2 groups that were used in this study: an experimental group that received a 10-week exercise program and a controlled group that completed a 10-week baseline assessment. The findings of this study struggled to show the benefit for depression symptoms, but it did, however, show that the exercise group experienced much lower pain after 10 weeks and were experiencing a higher quality of life. The results of the study support the idea that exercise is beneficial for patients of traumatic brain injuries. A similar study was created in 2012 by WISE. The goal of the study was to discover if exercise improvements would be maintained 6 months after the intervention was complete. A treatment group received 10 weeks of training sessions conducted by a certified athletic trainer. Sessions were conducted at moderate intensity for 30 minutes. After training for 10 weeks, participants were examined every 2 weeks for a total of 6 months. Depression, mental health, and perceived quality of life were better for all the patients after 6 months. There are numerous reasons why exercise is beneficial during the rehabilitation process of traumatic brain injury patients. Exercise has the potential to enhance recovery of cognitive and motor function after mild, moderate, and severe traumatic brain injuries. Incorporating exercise into the recovery process may increase the rate for which the patients regain their normal function. Exercise has been shown to reduce negative symptoms commonly associated with traumatic brain injury patients, such as depression, pain, anxiety, and insomnia. Exercise has also been shown to have a very positive improvement on the quality of life that a patient with traumatic brain injury experiences.